We are covering the Clinical Laboratory Improvement Amendments, or CLIA, specifically the different tiers of laboratory regulation, a critical topic for your phlebotomy certification exam. The CLIA-88 regulations establish federal quality standards for all non-research laboratory testing performed on human specimens. The primary goal is to ensure the accuracy, reliability, and timeliness of patient test results. And the entire program is overseen by the Centers for Medicare and Medicaid Services, known as CMS. For the exam, you must be able to differentiate the three main tiers of test complexity. The first and most relevant for a phlebotomist's hands-on testing role is the waived category. Waived tests are defined as simple procedures with a low risk of producing an incorrect result. Think of point-of-care tests, or POCT, that you might perform. Exam questions will expect you to recognize common examples like urine dipstick tests, rapid pregnancy tests, fecal occult blood tests, and blood glucose monitoring. A typical exam trap is to include a more complex test in a list and ask you to identify which one is CLIA-waived. Your hands-on role in testing is almost exclusively in this waived category. The next level is moderate complexity. These tests are more complicated, require a higher level of training, and carry a greater risk if an error occurs. Examples include automated complete blood counts and many chemistry panels. As a phlebotomist, you will collect specimens for these tests, but you will not perform the analysis. The exam will test your understanding of this scope of practice. A question might describe a scenario where you are asked to run a CBC on an automated analyzer. The correct answer is to recognize this is outside your scope and must be performed by qualified laboratory personnel. High-complexity tests are the most sophisticated and require specialized scientific knowledge and expertise. Errors in these tests can have severe consequences for the patient. This category includes tests like cytology, advanced molecular diagnostics, and immunohistochemistry. From an exam perspective, your role here is strictly limited to proper specimen collection and handling. Any question suggesting a phlebotomist perform or even assist in the analysis of a high-complexity test is a scope of practice violation. There is also a special subcategory called Provider Performed Microscopy, or PPM. These are specific moderate complexity microscopy tests, like KOH preps or wet mounts, that can be performed by a physician, dentist, and general practitioners, or mid-level practitioner during a patient's visit. You simply need to know this category exists and is defined by who performs the test at the point of care. To help remember your role, use this phrase: if it's waived, we're involved. If it's moderate or higher, we move to the hallway. This reinforces that your direct involvement in test performance is limited to waived tests. The exam will focus heavily on your ability to categorize these tests and, most importantly, to understand the precise boundaries of your duties under CLIA regulations. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.